Now, rural hospitals became financially strained after buying PPE, preparing for a flood of COVID-19 patients. Alexa Liaco is taking us to a hospital still awaiting a surge in its ER.
Nurses are on standby. This is a special order. The ICU is stocked.
We're ready to go.
But Duncan Regional Hospital is still waiting.
We saw cases increasing. At this point, hasn't come to Duncan quite like we expected.
As coronavirus cases overload emergency rooms across the country, this rural hospital has only seen a handful of cases.
I see you, this is Laura.
But the fear of what would happen if that surge came looms over the staff.
The most difficult thing is that there's not a lot of backup. So I'm the only pulmonologist here in Duncan.
So they've gathered PPE, preparing for the worst.
It used to actually be a storage room for our gift shop. Now we turned it into our PPE storage room.
Chief Nursing Officer Kristen Webb says it's been tougher to get critical supplies as a smaller hospital.
The last time we were able to receive N95s was probably in December.
When she could find supplies, she spent every penny she could to make sure staff would be safe.
We probably spent close to $1 million on equipment, PPE, or other supplies and equipment towards a pandemic that we didn't fully realize at this point.
That massive expense made harder because the hospital had to cancel all elective procedures and appointments.
Rural hospitals in particular are financially strained. When everything else shut down, when businesses shut down, our elective procedures shut down. So there is a financial burden that the hospital had to bear.
The burden extends past these walls to Jefferson County Hospital. Duncan Regional helps this critical access hospital stay open. It's a facility with only 18 beds that was on the verge of shutting down just a couple years ago.
We don't have the advanced diagnostics. We don't have access to the specialists.
But if the pandemic spreads, this is the place people will turn to.
We can't let our guard down.
Because even if it's quiet now, that can change in an instant. I'm Alexa Liaco.